This man needs no introduction, being a well-known personality in the pharma industry. He has been involved by the government on several important committees. He has not only been a member of the think tank, but also in the decision-making process. His contribution to our association has been phenomenal, and he has strengthened IDMA's position not only in India, but globally. At a very young age, he has been one of the few presidents who have been requested to continue for an extra year. Under his leadership, he introduced an inspiring theme to drive the industry and IDMA forward, and that is RITE, right. Our regulatory reforms, innovation, team building, and entrepreneurship. His vision has not only strengthened IDMA's position, but has also paved the way for a more dynamic and progressive Indian pharma industry. It is now my honor to invite our popular and dynamic National President, Dr. Viranchi Shah, to please deliver his presidential address. Over to you, sir. Please.
A very good evening, friends. Most respected Shri Piyush Goyal ji, Honorable Minister of Commerce and Industries, a true friend and mentor for the Indian pharmaceutical industry, Dr. Rajiv Raghuvanshi, the Drug Controller of India, the man who drives regulatory reforms in a big way in India, Dr. Karakiwala, an icon who represents that the Indian industrialists can indulge and succeed in innovation. Shri Bharat Shah, the incoming president, Mehul Bhai, Daraji, Dr. Hamid, the gentleman who has laid foundation stone for the entire pharmaceutical industry, and I think whatever we are today, we owe a lot to him, the kind of contribution he has had for the nation. I'm specifically inserted in this slot because last time when Piyush Bhai was here, I had the privilege of having a fireside chat with him. Today, we are here not just because it's a 63rd annual day for us, but it's because kind of contribution this industry is having. Piyush Bhai, you are a very eminent politician and a very sharp chartered accountant. And I'll just put a small statistics for you as a food for thought. Sir, between 2000 and 2020, in the 20 years, the average life expectancy for Indians increased from 63.2 to 67.3 years, which is about 4 years and a month. In terms of days, it translates to about 1,500 days in the span of 20 years, which is roughly about 1,040 weeks, if you put it that way. So, and this contribution is not only for the pharmaceutical industry, it's about the entire healthcare, the government and regulators, everybody. Sir, for 20 years, on an average, we added 1.4 days of life to a common Indian citizen consistently every week. Now, if you see the amount of spend that we have, now, the overall spend on the healthcare in India, and I'm talking about the pharmaceuticals, diagnostics, devices, hospitals, everything put together, is close to $100 billion for a $1.4 billion population. If you again use math, we are spending around $75 per person per year to achieve this life expectancy, which means we are investing, or rather I would say we are spending almost $1.50 per week per person. And if you put the math together, we are actually on every dollar that is spent on the Indian healthcare system, we are returning 1 day of extra life for an average Indian citizen. And that is the very reason, sir, that is the very reason we are all here. Piyush Bhai has a special aura. In Hindu mythology, we have something called Ashwini Devta, sir. And these Ashwini Devtas usually roam around in the evening, and that's why we all say that in the evening you should not sleep, you should speak positive, because they always give tathastu. And Piyush bhai, I remember when you were last with us at our 60th year celebration, we discussed three things. The first request that we made was, then in 2022, we didn't have road tape in pharma. And my first question to you on the fireside chat was, sir, can we expect some good news on road tape? Because pharma was one of the few industries that was not covered under road tape then. And fast forward today, the tathastu was there, and thanks to your effort, we have road tape in pharma. The second request I made, sir, to you was regarding the track and trace. And we made a lot of explanation to you why and what are the issues with track and trace. And again, with that tathastu, fast forward today, the problem that was there with us for the last 13 years is gone. Again, thanks to Piyush bhai and his support to all of us. The third discussion, sir, we had with you, in fact, that was something that came from your side. And in your speech, you suggested that Indian pharma should think upgrading its quality standards. We should have a vision of reaching peaks, or at least the WHO GMP standards. And if we are able to do that, there is a wonderful growth journey for India. And sir, fast forward today, with the support of Dr. Viranchi and everybody in the Ministry of Health, we have a situation where we are almost there. So I think those three tathastus have really been defining moment for us as far as our engagement with you is concerned, which also puts a lot of pressure on us. What should I ask for from you today? Because I'm sure you still carry the aura and you are going to say tathastu. So there are two requests I would like to place in front of you, and I hope we are going to have a tathastu from you. The first request, sir, is regarding simplification and ease of doing business. And we all understand that globally, a lot of things are changing post-COVID. Manufacturing bases are developing in many countries across the world. And therefore, Indian industry should continue to become more and more efficient in whatever we are doing. And therefore, decriminalization, simplification, and digitalization. Decriminalization, simplification, and ease of doing business is one of the requests that I'm making on behalf of the industry, and I hope we have the tathastu from you on that. The second request, sir, is we are banking big on innovation, and we all understand that the future for the industry is innovation. We are thankful to the government for considering the PRIP, which is supporting innovation in this sector. Yet, sir, we need something like 32.5 AB, where there was a 200% subvention of the expenses made on innovation. And with your face, I can make sure that you are not in agreement with this and there is no tathastu on it. But sir, at least the request is, if anything that can help supporting the R&D at enterprise level will actually be very important to take this innovation to every single manufacturer or player in the pharma industry across India. So these are the two requests I have on behalf of the industry to you, and I hope in some or the other form, when we meet next, we will take your tathastu and we will have some positive news on that. Thank you, sir, for sparing your time and coming here, and a big congratulations to you for a super victory in Delhi. We are all eager to hear from you today. Jai Hind. The stage is all yours, sir.